A fracture, a break to the continuity of the line of a bone. So typical types of fractures: closed, where the bone is still within the skin; open, bone protrudes out through the skin; complicated, within the line of a body tissue; green stick, which is much more susceptible to children. Signs and symptoms, so this might be swelling or bruising at or close to the site of the injury; loss of power, so perhaps I'm unable to hold on to a pen; irregularity, so you just look at it and it just doesn't look right; pain; deformity, often with a fracture to the pelvis, you get one or the other foot turned out; unnatural movement, goes through a range of movement it's not designed to do; crepitus, which is a grating noise where you hear the ends of the bone grating against each other; tender, at or close to the site of injury. Treatment: keep still, don't move it. So get the casualty, they'll probably hold it in the most comfortable position for them, and seek medical attention. Dislocation: head of bone become displaced at the joint. So most dislocation, as the picture shows there, to my shoulder. Next one is to the knee. Signs and symptoms very similar to those of a fracture. Again, treatment again as a first aider. Keep it simple, keep it still, don't move it, and seek medical attention. Do not re-scored, do not re-emphasised, do not put it back in again. Highly unlikely to die of a dislocation to the shoulder, but clearly I may well cause major internal injuries if I relocate it. So treatment, keep it simple, keep it still, don't move it, seek medical attention. Okay, use of slings then. So we've said treatment for a fracture, keep it still, don't move it. So I could just stabilise that by using perhaps some blankets, but potentially with a arm, or for a rib we may wish to use a triangular bandage. So I'm going to use my triangular bandage for fracture to the arm. So triangular bandage. What do I need to know about a triangular bandage? Well, it's triangular in shape. With the triangular bandage, I need to identify the long part. Long part is called the base. Opposite the base is a point. I need to tie a knot in the point to remember to do something with it. So I'm going to do a support sling to start with. So I've got my casualty here. She has a potential fracture to one of the long bones, so ramus or ulna, or to the humerus bone. I've sought permission and we've determined that we're going to do a support sling. So, point. Point, to remember, goes to the injured arm. The base comes down the uninjured side. So this is the injured arm, so this is the injured side, and this is the uninjured side. So, with my point needs to go to the elbow, base goes down the uninjured side. It's a support sling. Okay, just take your good arm away, don't we? Okay, and I'm just going to bring that underneath. So I've got the point to the elbow, base comes down the uninjured side, and tie this off. Just support that good arm for me, injured arm for me, please. And tie this off on the uninjured side. I'm going to use a reef knot. Right over left. Left over right. Okay, just let your arm go. Bring your arm in. Okay. So I'm just looking to try and ensure that I've got the wrist there slightly higher than the elbow. So a support sling. The other sling I could do is an elevated sling. So elevated sling, this is for a small bone, so wrist or fingers, elbow or collarbone. Again, I need to remember my point goes to the injured elbow, the base, the long part, that's coming down the uninjured side. So difference this time with the elevated sling is that the elevated sling goes over the top. Okay, let go of your good arm for me, please. Again, I'm going to tie it off, again using my reef knot, but this time on the uninjured side. An elevated sling. Sprain overstretching to a joint ligament, strain overstretching to a tendon or to a muscle. A ligament white in colour because it has poor blood supply. Signs and symptoms very similar to that of a fracture. Fracture, generally speaking, that will heal within 6 to 8 weeks. So treatment generally for a fracture, we said before, was keep it still, don't move it. It's going to be stabilised, plastered, 6 to 8 weeks. A fracture will generally heal, but a ligament or a tendon, no, it won't. It's going to take an extended time period. Often with ligaments, don't repair at all. So signs and symptoms, again, very similar. It's only really by having an x-ray I can identify, is it a strain or is it a sprain? Is it a fracture? Is it a dislocation? Signs and symptoms for all four are very similar. Treatment for a strain or sprain, the acronym of RICE. Rest, get them to stop what they're doing. Cold compress, 10 minutes. Compress by using my conforming dressing, so from my first aid kit, and elevate it above the heart. Okay, so treatment for a strain or sprain, we've used the acronym of RICE, rest, ice, compress and elevation. So my casualty here has a potential sprain to her wrist here. So I'm going to get her to stop what she's doing. Cold compress, so my cold instant hyper. Break that. I'm going to apply that cold compress. This is nice and cold. And apply that for 10 minutes. Having applied that for 10 minutes, I'm going to use a conforming dressing. So this is the dressing but without the pad part. So that's been applied there for 10 minutes now. So I'm going to take that around the wrist to start with. Okay, just bring your fingers nice and straight for me. I'm now going to move it around the joint. And I can just take that up as I previously did. Cramp, a sudden involuntary and painful contraction of a muscle. So I'm sure we've all had a cramp at some stage. So the muscle becomes solid, hard, I'm unable to relax it, painful contraction. Treatment for cramp, gentle extension, gentle massage. So get them to stretch their own muscle out, get them to rub their own muscle.